Treatment Options for Major Depressive Disorder by Jasmine Washington. What is major depressive disorder according to the DSM-5? It's a psychological disorder characterized by sad or low mood and anhedonia. One must have these two symptoms above, but must have 5 symptoms in total. Some symptoms may include sleep changes or loss of energy, and the symptoms must be present every day, most of the day, for 2 weeks or more. Available treatments include medications and psychological treatments. Medications that are often prescribed are SSRIs, or selective serotonin reuptake inhibitors, and the main form of psychological treatment is cognitive behavioral therapy, which focuses on the individual developing habits of thinking in different ways than they are accustomed to. A combination of medication and psychological treatment is proven to work most effectively, but let's focus on the psychological aspect. Why? Because although medication is effective treatment, psychological treatment explores situations an individual might encounter. And when discontinuing medication, symptoms could easily be relapsed, and psychological treatments could provide learned habits that are meant to be applied to everyday life. Cognitive behavioral therapy is a common type of talk therapy intended to correct cognitive distortions. The behavioral aspect to it is putting things into practice, such as scheduling activities and finding hobbies. A meta-analysis was done in 2019 in the Journal of Behavioral Medicine, where researchers found that CBT is prevalent across different settings, rather than a primary care setting. This is possibly due to a lack of insurance or a lack of access to insurance. Other types of therapy are mindfulness-based cognitive therapy, a subset of CBT that practices mindfulness through meditative exercises. Behavioral activation therapy, which is helping someone do positive reinforcing behaviors that can affect their emotional state. And interpersonal psychotherapy, which is a therapy that works through someone's interpersonal relationships, whether they be familial or intimate. Why is this all important? Because psychological treatment is a key intervention for people who suffer from severe depression or are planning to harm themselves or take their own life. Although mental illnesses are not curable, treatment makes it easier to manage, and this is especially important for teenagers and young adults. These individuals will be able to function and be successful in society. Remember to seek out help. You don't have to do this alone. Remember, it's okay to talk about it. Talk to family, friends, professors, advisors, anyone that you feel comfortable with. And if you are experiencing a crisis, visit these websites to get the resources that you need.
Created using Powtoon.